CNA Practice Sets. Welcome to the quiz. Question 1. Therapeutic communication techniques facilitate emotional expression and psychological support. When Mrs. Johnson, a 72-year-old widow recently admitted to the facility, tearfully expresses feelings of profound sadness and loneliness following her husband's death, what response demonstrates effective therapeutic communication? Option A. Don't be sad, Mrs. Johnson. Things will get better with time. Option B. I understand exactly how you feel since I lost my grandmother last year. Option C. Tell me more about what you're feeling right now. Option D. You should focus on the positive aspects of your life. The answer is C. Open-ended invitations to express feelings demonstrate therapeutic communication. This approach validates emotions and encourages processing. Minimizing feelings, don't be sad, invalidates emotional experience. Claiming exact understanding may not be accurate and shifts focus. Advice giving, focus on positive, doesn't address emotional needs. Active listening and encouragement to express facilitates emotional healing. Question 2. Proper positioning during assisted ambulation maximizes safety and support. When preparing to assist Mr. Davis, who has right-sided weakness following a stroke, with ambulation in the hallway using a gait belt, what represents the optimal positioning for the nursing assistant relative to the patient? Option A. Position yourself slightly behind and to the side to observe gait pattern. Option B. Stand directly in front of the patient to guide forward movement. Option C. Hold onto the gait belt from directly behind the patient. Option D. Stand on the patient's stronger left side for optimal support. The answer is D. Position on the stronger side provides best support and stability. The assistant can support the weaker side and help maintain balance. Being behind doesn't allow forward guidance or good support. Being in front is impractical and doesn't allow assistance with balance. Holding from behind provides poor control and doesn't support weaker side effectively. Stronger side positioning optimizes safety and assistance. Question 3. Different pulse assessment sites serve specific clinical purposes in various situations. During an emergency response drill, the instructor asks which pulse site should be assessed first when evaluating an unresponsive adult patient. Which pulse site should typically be checked initially during emergency assessment of an unresponsive patient? Option A. Radial pulse at the wrist for rapid accessibility. Option B. Carotid pulse in the neck for central circulation assessment. Option C. Brachial pulse in the arm for basic life support checks. Option D. Pedal pulse in the foot for peripheral circulation evaluation. The answer is B. Carotid pulse is checked first in emergencies because it indicates central circulation and is accessible during CPR. Radial pulse may be weak or absent in shock. Brachial is used for infants. Pedal pulse assesses peripheral circulation but not immediate life threat. Carotid assessment quickly determines if CPR is needed. This follows emergency response protocols. Question 4. Regular repositioning of immobile patients serves multiple therapeutic purposes. When explaining the importance of turning schedules to a new nursing assistant, the charge nurse emphasizes the multifaceted benefits of regular position changes. What represents the comprehensive primary purpose of systematically turning and repositioning a completely bedridden patient every 2 hours? Option A. Improve peripheral circulation and prevent venous stasis. Option B. Prevent pressure injuries on bony prominences and skin breakdown. Option C. Promote patient comfort and reduce musculoskeletal stiffness. Option D. All of the above represent important benefits of regular repositioning. The answer is D. Regular repositioning serves all these purposes, improves circulation. Question 5. Appropriate glove selection depends on procedure type and potential exposure risks. When preparing to assist with a sterile dressing change for a postoperative wound, you must select the proper glove type. When should sterile gloves rather than clean gloves be worn by nursing assistants? Option A, when providing routine perineal care for an incontinent patient. Option B, when handling contaminated linens from an isolation room. Option C, when performing sterile wound care or dressing changes. Option D, when assisting a patient with feeding during mealtime. The answer is C. Sterile gloves are required for sterile procedures like wound care to prevent infection. Clean gloves suffice for non-sterile tasks like perineal care. Question 6. Recognizing postoperative complications enables timely intervention and prevention of serious outcomes. While completing afternoon vital signs for Mrs. Rodriguez, who underwent abdominal surgery 48 hours ago, she reports sudden onset of sharp chest pain, shortness of breath, and appears visibly anxious. What immediate action should you take based on this concerning presentation? Option A. Elevate the head of the bed immediately to ease respiratory effort. Option B. Notify the registered nurse immediately of these acute symptoms. Option C. Administer supplemental oxygen from the wall outlet if trained. Option D. Encourage the patient to cough deeply to clear potential secretions. The answer is B. These symptoms suggest potential pulmonary embolism or other serious complication. Immediate nurse notification is critical for rapid assessment and intervention. Elevating the head may help breathing, but doesn't address the underlying emergency. Oxygen administration might be needed but requires nursing assessment first. Encouraging coughing is inappropriate for potential embolism and could worsen the situation. Rapid reporting enables timely life-saving interventions. Great job! Don't forget to subscribe. Bye!